for the future of it.
Great. Okay, hello, how are you?
Good, how are you?
Okay, everyone ready to go? Well, good morning. It's great to be in Hervey Bay today with my parliamentary colleague and the hard-working member for Hervey Bay, Adrian Tantari. Joining me today also the Assistant Treasurer, Charisse Mullen, the State Member for Jordan, and also the leadership team from the Wide Bay Hospital and Health Service, including the Chair Peter Jamieson and the CEO Debbie Carroll. Great that they have joined us here today. As you know, our budget is focused on three pillars, three strong foundation points for our state. Supporting more jobs for Queenslanders, supporting better services, and of course protecting the amazing lifestyle that we all love so much in Queensland. And particularly on the Fraser Coast, one of the best lifestyles in our state, something that our government is keen to protect and enhance. And that's what our investments in this budget for 2022-2023, that's what our investments do. Today we're here to with more great news about our health system for Queensland and for this region. $772 million investing in the Wide Bay Hospital and Health Service this financial year. And that means an increased commitment into the Hervey Bay Hospital. Very importantly, as part of our budget commitment this year, we'll be investing funds through this financial year and beyond to support the expansion of the Hervey Bay Hospital. That'll be a $40 million investment in this hospital. That'll help open another 35 beds in this important regional hospital, including 10 more intensive care beds. And I know how hard Adrian Tantari has championed this hospital, the great health work that it does. He's also been a great supporter of the healthcare workers in this part of Queensland, and I want to acknowledge Adrian's hard work, his work championing the need to expand this hospital. And thanks to Adrian's hard work, we are delivering as a government. We're delivering for the mighty health workers who work here, we're delivering for this community, and we are delivering for the region. As part of that investment, there'll be a new rooftop helipad that we will build here, and that will help people living in the region. So if we need to medically evacuate people from who are in need of emergency care, for example, they'll be able to come directly to this hospital, and then that will then link to our emergency retrieval system across Queensland that we are expanding. A record commitment, $334 million over a decade to support the work of the Royal Flying Doctor Service to help Queenslanders wherever they live in the state, and then a $60 million new aeromedical retrieval centre at Brisbane Airport. So if people need to go to one of our large metropolitan hospitals for the highest quality care, they'll be able to have a seamless journey, particularly in cases of critical care or urgent care across the state. We're of course expanding this hospital when it comes to inpatient mental health beds as well. We know COVID has thrown up some challenges for our community, not just here in the region, not just here in Queensland, but around the country. COVID put a new spotlight, a new focus on the need to improve the mental health outcomes for our people. And that's something we've experienced during COVID, and our government is now investing as part of our record investment in healthcare in this budget, the biggest single investment in healthcare, both operating cost and capital cost in the history of Queensland. We're investing $1.6 billion over 5 years, the biggest single investment in mental health care in our state ever. And of course that's going to flow through to this part of Queensland. We'll invest in a 22-bed acute mental health inpatient unit here, but that's going to help the region. What we'll do now, that's almost $40 million. We'll start investing that this financial year and in future years. That's going to improve mental health across the Fraser Coast. So the number of mental health beds will go from 14 to 32. So we'll do this project first, and that will then allow us to refurbish the subacute inpatient care centre at Maryborough Hospital, and that will be focused on older citizens in the community. So it's an integrated plan, it's an integrated program, and I want to thank the Hospital and Health Service for thinking very deeply about the needs of this community and what we can deliver for the people of this community. Very importantly, these projects will create more local jobs. We're very proud of our investment across Queensland in multiple budgets now to support jobs across Queensland. Our record $59.1 billion capital program over 4 years. This year alone, about $15.5 billion. That's the highest capital investment across 4 years we've seen in Queensland for more than a decade. And that will create this year alone 48,000 direct jobs across the length and breadth of Queensland. Locally, in the Wide Bay region, that's $1.2 billion supporting 3,900 local jobs across the Wide Bay. So it's a very important investment by our government. We're proud to do that. We do that in every budget, but we've increased our capital investment again across Queensland and across this region. And we'll continue to support the growth of this region, particularly with more paramedics, with more doctors, with more nurses, off our significant commitment and increase in all of those since we came to government in 2015. So I might leave it there. I might hand over to Adrian to say a few words as well, and then we're happy to take some questions on that.
Thank you, Treasurer. I want to thank the Treasurer and Assistant Treasurer, plus the Health and Hospital Service management for being here today. Well, this is the plan. This is the plan. This plan brings forward a major commitment from the Palaszczuk government to upgrade the Hervey Bay Hospital. $40 million will go towards extending on this beautiful building that was put here and only commissioned in 2018. On top of that, we have another $17 million towards completing the health unit, the mental health unit that is needed here in Hervey Bay. That unit, $39 million of expenditure from the Palaszczuk government, will be commissioned next year. That is really great to see that the Palaszczuk government is supporting the growth here in Hervey Bay. The latest Bureau of Statistics show that the Hervey Bay and the Fraser Coast has grown by 7.3% in only the last 5 years. That is an additional 8,000 people that have come into this area, and that shows the reason why we need the commitments that are coming from the Palaszczuk government towards health in this area. Now, the proof is in the pudding, and the pudding is this plan, and that is that we will have a better hospital moving forward in Hervey Bay. The plans are there. With the Health and Hospital Service, as the Treasurer has indicated very clearly, has done a forward plan. That's why we're going in a new helipad on top of the building here. That's forward planning. It's very well done from the Health and Hospital Service that they have that plan moving forward. And this area in particular will grow from strength to strength as we develop this area over the next 20 years under the plan that the Health and Hospital Service has in place. So I congratulate the Palaszczuk government and I congratulate the Health and Hospital Service for the work they've done here.
That's great, Adrian. Thanks very much. All right, happy to take questions on that. First of all, any questions about our health commitment?
When will this all be implemented? When are the days expected to be here in Hervey Bay?
We expect the capital program to be completed by 2024, the end of 2024. Big project, as you can imagine. Big project to expand a hospital with another 35 beds. So we'll get cracking on that as quickly as possible.
So obviously we've seen numbers of hospital ramping. Is there a plan right now? We don't want to see, like in Victoria, per se, some overruns in their hospital and health system. We don't want to see an ambulance that not being able to get to people. Is there a plan right now?
Well, no government's done more to invest in healthcare in this state than the Palaszczuk Labor government. No government in our history. That's why we've got the single biggest investment. Not just the biggest investment, but the biggest uplift in both operating cost and capital cost. And the other thing we've been able to do is to protect our people during the worst pandemic in a century. No one could have anticipated this pandemic. Across Queensland today, there are 500 Queenslanders in public hospitals dealing with the consequences of COVID, and we can't forget that. Our people are still dealing with being infected by COVID. That's impacting on the lives of Queenslanders. Lives are being lost every day due to COVID. We've now got a super flu, one of the worst flu experiences that our state has had to go through in recent years. And I'd encourage all Queenslanders, if I can just say that, particularly in this region, to get your free flu shot. We've just expanded that until the end of July. That's a very important mechanism to protect Queenslanders. So no one could have anticipated the impact that would have. And you're right, it's not just Queensland. every other state in this country. It's actually around the world. The impact on the healthcare system continues to grow. That's why we've made this major investment in this budget, which we're really proud of. And it's not just for this region; it's all across Queensland. So a significant investment. Our ambulance budget, talking about ambulance, that's increased by 11% in this budget. So our investment in ambulance is going up 11% in this budget, more than $1 billion. That's more paramedics, 130 new and refurbished ambulances, new ambulance stations as well. So more staff, more facilities, more ambulances as well. So that's the investment we're making to protect Queenslanders at a really challenging time for our state. Okay.
That it might be too little too late. We need these new beds now. We're running short on everything at the moment. So what are the plans for right now? How can we help this crisis that's going on right at our doorstep?
Well, that's why we're investing in more staff, more ambulances and more facilities. That's the response to this crisis. And I mean, to be fair, the AMA called on us to deliver 1,500 beds. That's their call. That was their call to the government. And in this budget, we'll be delivering 2,500 additional beds over a period of time. You can't build hospitals overnight. I'd love to be able to do that, but you've got to make the investment first, and then you do the planning, the design, and then the investment in the infrastructure. So we're delivering about 1,000 more beds across Queensland than the AMA asked for. I think that's a very significant investment by our government, and that just shows you how seriously we take this as a government, and so we'll continue to make that investment going forward.
The beds that are being delivered to Hervey Bay Hospital, are they separate or include the mental health beds that are being delivered as well?
They're additional, yeah. So 35 new beds for Hervey Bay. They're general inpatient beds, 10 intensive care unit beds, and then we've got the mental health investment as well. That's proceeding as we meet today. All right. You okay on health? You got, yeah, separate questions, all right. So, well, we don't need our health people anymore. That's great. You won't need to have to answer those. Anything else today?
We might grab their health.
Yeah, sure, later on. Yeah. Well, why don't we do that now? So if you've got any health questions, we'll do health now, and then we'll move on to anything else, okay? So what, go for your life, yeah.
Hello.
Okay, could you start us off with name and spelling for us, please?
Debbie Carroll, Debbie Carrorrell.
Beautiful, and your position as well with the hospital?
Chief Executive.
So what does this investment mean for you?
This investment means to us we've got more beds coming online. So certainly for the clinical staff on the ground, we welcome this announcement today that we'll have 35 extra beds for acute patients and 18 additional mental health beds. So this is a significant investment in Hervey Bay Hospital and expanding our bed base. So this is a very welcomed announcement.
How desperately needed are these beds here?
So certainly we need additional beds. We have got a growing population. So we do everything internally to look at our models of care. That includes out-of-hospital models of care, hospital in the home, etc. But we certainly need these additional acute beds, so welcome announcement.
And how is the HHS going with the staff shortages at the moment? We've seen that across the country, obviously. How is that going? Do you need more staff?
So we're certainly feeling the impact of COVID and the flu season, that we've got a number of staff that are off unwell. So it certainly has some of those challenges, but the staff are absolutely amazing in what they do each and every day to provide the best possible care. And we are certainly recruiting all the time. And certainly looking after the wellbeing of our staff. But it's certainly challenging when you've got quite a few staff off sick and trying to replace those shifts as well. But they work well as a team, and I'm really proud of what they do.
And what will it mean to have that separate mental health service here now as well?
It's extremely important to have the acute mental health unit on site in Hervey Bay that allows us to then build an older person's unit in Maryborough after this unit is commissioned. So it's certainly welcome to have additional beds and certainly to have the community acute care team located in the new building as well. But it's going to be a friendly environment for the consumers to make sure we can make that a positive experience for them. So a lot of work has gone into the design to make sure that it meets the consumers' needs, and they've been involved in the planning of the unit as well, so an important aspect.
We're getting a new helipad here as well. What would that be like for you guys here?
It's certainly with some forward thinking to design the building so it was capable of having the helipad, so a credit to the infrastructure team, and it's certainly a better location than just behind us, so that'll create some additional space that we can use as well, but it'll be just the ICU will be below the helipad floor and then direct access to the emergency department, so a far better location, so that's a welcome addition as well.
And 2024 is still some time away. Are you confident that these facilities will last you until we see those new ones completed?
So certainly, as I say, working well with the team. We also got funding for additional 18 beds in Maryborough, which we've commissioned as well. So we've invested, the government's invested in Maryborough as well, so we've got those beds open. And we certainly partner with our private sector. And this year's funding has got 20 interim care beds that we funded for aged care type patients as well, which present some challenges. So it's very much about those models of care and what we can do collectively and work with our QAS partners as well.
Okay, thanks Debbie, thanks Peter. I might also add on that in relation to our investment into operational costs. Hospitals, well, our health system is more than just hospitals, and we must always remember that. How we treat and care for people in the community is very important. We know that the general practice, we know that primary health care is a fractured and broken system across our country. People are flat out getting in to see a GP, let alone a bulk billing GP. The cost of specialists is skyrocketing. We've got one of the lowest rates of private health insurance now in the country, and that's all a legacy of 9 years of federal coalition government that did not address the core problem, which is improving primary health care. So what we've said to our hospital and health services, we have to deal with our responsibilities, but what we've said is we're looking for new and innovative models of care. So if we can do more in the community through hospital in the home, through in particular prevention and early intervention before people get sick, so sick that they need to come to hospital, both for a physical ailment or a mental health condition, that's going to be a really important initiative, a really important change. So our hospitals shouldn't just focus on activity, which is medical procedures, diagnostic testing. They should look at the whole patient journey, and the more we can do in the community, and I know Debbie and Peter will be very committed to that in leading the hospital and health service, I think the better that will be. We know if we're treated closer to home, we have better health outcomes, and that's going to be really important. So we're putting the challenge to the hospital and health services across Queensland to come up with new and innovative models of care, and we're going to support them doing that. All right, happy to take any other questions.
Treasurer, the opposition's accused you of being so ashamed of this budget that you've gone into hiding. Do you have any reason as to why you waited until now to come to the regions and spruik the budget?
Look, I mean, being lectured to by the LNP on healthcare is like being lectured to by a drunk on why you should give up alcohol. Like it's an embarrassment. Let me just say this about the LNP. A few things I'd like to respond to the LNP on. Firstly, we got a shadow health minister who is proudly a member of an organisation that has consistently expressed anti-vaccination views. That's a person the LNP wants to put in charge of our health system. Now, I know the older citizens here, particularly in Hervey Bay, would be greatly concerned, in fact would be fearful of someone who is a member of an industrial organisation, and I can use that term very broadly, the Nurses Professional Association of Queensland, who consistently expresses anti-vaccination views. Can you imagine what would have happened to this community if the virus had come to Hervey Bay and the Wide Bay and we weren't protected by vaccination. It would have been a disaster the likes of which we saw around the world, and it would have happened here. But our government would not be bowed by the LNP, who wanted to open our borders early. We wanted to protect our people, led by our Premier, led by people like Adrian locally, to make sure our community was protected before Omicron arrived. And that's the person who would run the health system. Ros Bates would run the health system under the LNP. Secondly, let's talk about the budget. The opposition leader spoke for longer than I did. He spoke for longer than I did, and he promised one thing to Queensland: a committee. That was his promise to Queensland. That's his alternative vision: more bureaucracy. So I'm not going to be lectured to by the LNP. And of course, in their election commitments, this is something they all agreed to. The leader, the deputy, the shadow health minister, they wanted to strip thousands of health workers out of our health system this parliamentary term. Can you imagine how we would have dealt with COVID, with thousands of less health workers? That was their commitment. So I do what every treasurer has done. I've taken our story to the people who support us and invest in Queensland. I've just had an investment trip to Sydney and Melbourne, and I can tell you the interest in Queensland is amazing, particularly with the horizon to the Olympics, which will benefit all of our state and beyond. And we know why southern states are interested in us, because our financial position is better than theirs. You know, this financial year we delivered a surplus, a $1.9 billion surplus. The budget deficit in New South Wales, led by a Liberal government, is $16.6 billion this year. A $16 billion deficit, and we've delivered a surplus. So that's what you get under the LNP: more debt, higher deficits, crushing the community. Under Labor, not only lower deficits, we've delivered a surplus, lower debt, and a record investment in healthcare. So that's what we're doing as a state. And I'll be travelling all across Queensland. I'll be particularly going to LNP areas and talking to those communities about what health investments we're making there, including building a new hospital in Moranbah, great mining community, when the LNP offered them and promised them nothing but cuts. Anything else?
Yeah, we've had some local businesses express concerns that in this budget they'll have to absorb the costs of rising energy. How would you respond to those businesses? Well,
we've just provided a tax cut to small and medium-sized businesses in particular. So that's a very significant reform by us, up to $26,000 that will go back into the bank accounts of businesses each and every year. So we've used our strong health response to COVID. That's enabled an amazing economic response, the strongest economic response in the country. Higher economic growth, more jobs, and in the Wide Bay, it's been a phenomenal response when it comes to healthcare and, of course, employment. What we've seen is a drop, a 33% drop, a third drop in unemployment in 1 year. Youth unemployment in this region has dropped 30%. This is the lowest unemployment rate in the Wide Bay for more than a decade. And that's what I promised when I became the Treasurer. I promised more jobs for Queenslanders. It was one of my strong areas of focus, and now we have delivered that. And I'm so pleased there are so many people. So businesses can be confident. Business confidence is near the top of the leaderboard across the country when it comes to Queensland. We've got retail spending is up about 25% over COVID, so more people are spending in the community, and we've got more people in jobs. So that will help business prosper, that will help them be successful, and of course we're providing them a payroll tax cut, which I think is a really important thing, particularly those small and medium-sized family businesses that really did it tough during COVID. We're now giving back to them, and I think that's really important for this community, for regional communities, and for Queensland. Yeah, the Premier's put out a statement today and said she's going to lead the team till 2024, and that's a great thing.
Should the government apologise to public servants after the contract review?
The Premier's made it clear. You know, we need to get on with the job of improving the public sector, improving standards, improving culture, and improving outcomes. And so that's what I'm also focused on, making sure we deliver on the promises we made to the people in our election, which we're now delivering, and then also the commitments we've made in our budget. Good jobs, better services, protecting Queensland's lifestyle. That's what we're here to celebrate today, and that's what we'll continue to focus on. But, you know, we're going to support our public servants. Everything that I've achieved in public life has been because of the great work of public servants, whether it be in healthcare, strengthening the economy, in other areas of work. So we value our public servants, we recognise the work they do, and we'll continue to support them. And I very much look forward to working with our hard-working public service wherever they work in Queensland as part of that big army that supports the prosperity of our state. I look forward to working with them in the future.
Do you think the government should stop dealing with lobbyists who helped the Premier on her 2020 election campaign?
Well, what we're going to do is implement the cold rake review. The Premier's made that very clear. She's made it clear that the government is to implement the 14 recommendations, and that's what we'll do as a government. We're going to have a discussion of that in Cabinet. The Premier made that clear yesterday. So we'll continue to look at all those recommendations. There's some big changes there, and we'll have to develop an implementation plan, and we've got the Director General of the Department of Justice who's going to lead that team in government. So that's a big project for us, and we're going to get on with delivering as the Premier has told the people of Queensland.
And just in regards to the cold rate review, does this government have a problem with secrecy and cover?
No, not at all. Absolutely not. Look, we are the most transparent government in Australia. The reason that people know about lobbying in Queensland is because we have the most open register in the country. How many people lobbied the previous Morrison government? Nobody knows because they didn't have a register. So we've been very open. Our integrity reforms have led the state and led the nation. No government's done any more than we have when it comes to, done more than us when it's come to integrity reforms. That's been very significant. Certainly disclosing the source of donations, that's been a very significant reform, including real-time political donations. That's never happened before in Queensland. We've done that. The LNP wanted to protect people with brown paper bags with $10,000 in cash that could be given to a politician, and the world would have never known about it. Now, we've lowered that threshold. We've implemented real-time disclosure, a whole range of other reforms, including the declaration of conflict of interest for ministers in particular. That has been a significant improvement. So we've responded to the integrity agencies when they've come up with recommendations. We've adopted that, and just as we've got another report from Professor Coldrake, we'll now implement those, and we'll have a strong, open and accountable government, which is what we have been since our election in 2015. That's not true, and I don't agree with that at all. Anything else?
Just in regards to the new financial year, how should Queenslanders be feeling?
Queenslanders can feel so optimistic. We have the best economic recovery in the country. We've had the best economic growth of any state in the country. We've had the best jobs growth of any state in the country. Not only have we created more jobs than any other state, we've created as many jobs as New South Wales and Victoria combined. And on my state of origin tour to the southern states, I was very pleased to remind them of that. We're 20% of the Australian economy, we're 20% of the country's population, but we have created more jobs than any other state, and we've created more jobs than the two big states combined. So what does that mean? People can be confident and optimistic going into this financial year. Yes, we have some challenges. We've got some challenges that the world is throwing at us. We've got some challenges in our national economy, but Queenslanders are the toughest and most resilient people in the country. And we know that we can do it because we had the best health response to COVID. We stared down COVID. We've had the best response, and now we're getting the best economic response to COVID. And that means we're capable of achieving anything as we look forward to this year and then the next decade running into the Olympics. Queensland is the place to be. You wouldn't want to be anywhere else. It's a great place to live, to start a family and to start and grow a business, and that's what I'm absolutely committed to delivering on as Treasurer and Minister for Trade and Investment.
The member for Maryborough has gone out in public and said that he wants whistleblowers from the Coldrake review to be exposed. Do you support his comments?
Oh, that's Bruce being Bruce. He's very passionate about his community. You know, he loves being a Labor Member of Parliament. He loves working for Maryborough. He's been probably the most effective member for Maryborough in a lifetime, probably longer. He's worked really hard. It's not been my experience with public servants. They all work very hard. So Bruce is very passionate about his community and has delivered for them, just as Adrian is delivering for Hervey Bay. So he'll continue to work hard for his community. All right. Thanks, everyone. Thanks for coming along today.